as I've gone through these risk factors, almost always something comes up at the end that they say, well, why has no one else ever gone over this stuff with me? I don't understand. Why haven't they told me this? And I do believe dentistry and dentists need to do a better job of educating patients about why it's happening, not what's happened.
Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
Hi, this is Dr. Bruce Baird with the Productive Dentist Podcast. This is episode 102. Hard to believe. Coming to you from the mountains and the cliffs off Big Sur. Staying here at Post Ranch Inn. I've had a absolutely amazing 3 weeks. Summer's here, I guess, but spent time with all my grandkids in Mexico, down in Cancun, and we had 24 of us. We had an absolute blast. The week before that, we went with friends to Vegas and spent a few days longer than I should have spent probably, but we spent a few days. And now we came to Napa Valley for 3 days. Then drove down to Pebble Beach, played in the Clay Walker tournament. It's an invitational charity for MS. We got the opportunity with some friends to play Pebble, Spyglass, Spanish Bay, and that's been 12 years we've done that, and it's just been an absolute blast. Got to play with John Barnes, my best friend from dental school. We actually played in the tournament this year together, and just had a blast. And now, after 4 days at Pebble, we came down to Big Sur to stay at Post Ranch, where my wife and I stayed on our honeymoon, and kind of a special place for us. But why am I sharing all this with you? Well, it's the opportunity to go places because of being productive. And when you look at treatment plans and you look at the things that we do, it all comes down to having great case acceptance. But what is case acceptance? Well, is case acceptance telling a patient they need a crown and them saying yes? Well, yeah, that's case acceptance. But what I've seen happen over the years that has been kind of a sad state of affairs is dentists, are so tied to the insurance model that, they, and we've talked about it in the past, but they have a tendency to just tell the patient they need the one crown because the patients are too often saying, oh, can't we just do one? And so you get into this mode where you're constantly just going, well, you need one crown. This is your worst tooth. Let's get that done. Let's keep an eye on the others. Well, I've never in my career watched keeping an eye on something actually have that tooth get better. And so really what we teach and what we talk about at Productive Dentist Academy, and we've got a live event coming up in mid-September that is in Dallas, or in Irving actually. And over the next few podcasts, I'm going to be going through some of the topics that we're covering and improving case acceptance with comprehensive treatment planning. And it really helps you communicate that treatment plan that patients will accept. Nothing's more frustrating to me than seeing the condition of a patient and struggling to communicate a treatment plan. I think probably some of the most difficult things that I've watched in my career are dentists who have gone to Spear or Coyce or LVI or you name it, Pankey, and they learned all the tricks, all the techniques, all the new technology, but yet they still are not doing the comprehensive treatment plan because they don't feel comfortable communicating that. And, it's something that we talk about often. And, what we'll be talking about is effective patient and team communication, how to elevate our standard of care, building rapport that drives trust and loyalty, and talking about some advanced clinical hygiene. So what I'd love to see happen is every dentist look in the mouth and tell patients, what would you do if it was your mouth? I mean, just straight up, without a worry whether they're going to accept the treatment or not. And I'm going to share with you one of the things that I think is a secret to that, which is taking away the thought process of, well, Bob, you need this and you need that and you need to have this done and you need to have that done. To me, that doesn't communicate well. Patients' perceived need is probably going to be different than your perception of their need. And so what I want to do is go through a process that we educate the patient, and we do it in a different way. And I've always talked about building great communication with the patient, which, in my opinion, you have to get to know the patient. You can't tell somebody what they need if you don't know them. You can't tell them, oh, you need this. I would say, screw you. You don't know what I need. I need a new car. I need a job that pays more. But don't tell me what I need. And, so when I step back, I want to get to know the patient. Bob, how long have you lived in Granbury? Oh, I've lived here a little while. I see you live at Pebble Beach Drive. Hey, do you play at Harbor Lakes? Yeah, I do. What kind of clubs you play with? In other words, I'm going to build rapport and link with that patient. And I'm going to do that in a way that we become friends before I start telling people what they need. And that's what we're going to be talking about in the first session in September. But it is, I can hammer this over and over and over again. And it's critical to getting patients to say yes. The second thing that I do is I go into that process of looking at that patient's risk factors. And those risk factors, John Koist has done an amazing job talking about risk factors: periodontal risk, functional risk, biomechanical risk, aesthetic risk. I added physiologic risk, which throws in sleep apnea, and psycho risk. Are they crazy? And so I look at these risk factors and I go through those with the patient. And as I'm going through these risk factors, well, let me put it to you this way. As I went through the risk factors, listening to John Koist years ago, what hit me right between the eyes was, oh my gosh, I've been redoing dentistry for people that it wasn't my fault. It's not my fault that their dentistry failed. Their dentistry failed because they're drinking Dr. Pepper all day long. Their dentistry failed because they don't know which end of a toothbrush to use. Their dentistry failed because I told them to wear a night guard and they're not wearing it. That's why the dentistry failed. Now, I'm not saying that my dentistry is perfect, but I do believe that dentistry should have a great chance of lasting a lifetime if the patient follows our recommendations. And those recommendations fall into those risk factors. And we're going to get into that deep in September. I've got multiple podcasts on risk factors and what we do, so I welcome you to go back and listen to those. But as a highlight, I'd like to talk to you a little bit about, okay, let's talk periodontal risk. Bob, have you ever been told that you've had periodontal disease? And I'm saying Bob because now Bob and I are friends, because I know where he plays golf. We have friends in common. We're on the same page. And now I'm talking to Bob and I'm saying, has anybody ever said anything about that? And he says, well, they did one of those deep cleaning things one time. And I think they charged me like $400 or $500 or whatever it was for a deep cleaning. And I said, well, I totally understand. But I said, let me explain something about periodontal disease that, we've just learned, over the last 4, 5, 6 years, is the bacteria that can cause gum disease also can kill you. It can also cause Alzheimer's. I notice you have a history of some heart issues. I notice you have diabetes. These are things that affect those health situations. And the patients go, oh, wow, I guess I didn't realize that. And as I go through these risk factors with patients, what I'm doing is I'm building information for them so that they can make the decision. I then go in and I talk about a biomechanical risk, and I see erosion in the mouth, and I go, Bob, are you on any medications? Well, I'm on Lisinopril, I'm on this, I'm on that. If you look at the labels on that, it talks about dry mouth. And have you noticed? And I go, oh yeah, my mouth's so dry. I go, exactly. Well, what happens is, these medications will dry the mouth, but saliva is a natural cavity protector. It helps neutralize acid. And when you don't have the saliva, now I'm not telling you not to take your medicine, but what I'm telling you is we have to be extra careful with sugar and with and being on antibiotics and certain things. We have to be very careful on that. And the patient goes, wow, gosh, I didn't know that. And then functional risk. I will always throw it out that says, Bob, the average person bites at 125 pounds per square inch. That's how tight their bite is. And I say mine is over 1,000 when I had mine measured. That's why I break teeth. Now, I don't break them anymore because I wear what's called an occlusal guard. It's a piece of plastic that goes in and it helps me protect my teeth. And they go, wow, I didn't know that. Well, that makes sense. Anyway, I go through these risk factors, and as I've gone through these risk factors, almost always something comes up at the end that they say, well, why has no one else ever gone over this stuff with me? I don't understand. Why haven't they told me this? And I do believe dentistry and dentists need to do a better job of educating patients about why it's happening, not what's happened. Because if I can educate you about why it happened, then we've got a great chance of preventing it from happening again. And let me tell you something. Your patients will start doing the dentistry that you recommend, because the way you're going to recommend it is very different. And you're going to say, Bob, we've got multiple ways that we can handle this. But, let me just share with you what I would do if it was me. Well, that's why I go to docs. I went to the elbow surgeon. What would you do if it was you? Shoulder, what would you do if it was you? Any kind of medical problem, I want to ask that question. Well, what would you do if it was you? Why? Because they're the expert. I don't know elbow. I don't know shoulder. I know teeth. I know function. I know all the risk factors, and I know why things happen. And so patients will always ask that question. They'll say, well, why has no one else ever done this? Why haven't they ever told me? And my response is not because most dentists don't know it, or, they're just dropping the ball, or whatever I want to say. I'm going to say, you know what? Because we're learning so much. New technology, new thoughts, new things in science are showing up. But for the first time in my life, Bob, I think we can do some dentistry on you that should last the rest of your life if you'll just follow those recommendations. So anyway, that's my topic for today, is improving your case acceptance by doing comprehensive treatment planning, explaining to the patient not what's happened, but why it's happening. It's not about, the what. It's really about the why, because once they realize the why is their fault, they'll stop doing it, or they'll start following your recommendations. And truth is, some will follow them and some won't. But at least you're not finding yourself redoing dentistry that you have no reason to redo, because it's not your fault. And I redid so much dentistry over my career that really wasn't my fault. Now, I've redone stuff that probably was, but I've redone a whole lot more that wasn't. So anyway, I hope you enjoyed this. We're going to be back next week with another topic from September's course, and I look forward to podcast and episode number 103.
If you're losing sleep over your business and feel like you're already overloaded, but know your business needs attention, you just don't know how, when, or where to start, you're not alone. The reality is many dentists are overworking themselves, yet their practices are still struggling to be as productive as they should be. This is not sustainable, and there is a better way. That's why PDA has developed a transformative new program, Business Impact Foundations, to get you above the daily chaos and propel your business into an investment-grade practice. Using easy-to-implement proven methods combined with a unique learning atmosphere, you can activate a strategic growth plan in just 60 days. If you want to clarify your vision, align your team, and elevate the health of your community like never before, call us right now at 1-800-757-6077, extension 8, or head over to productivedentist.com/foundations to secure your spot. We have 2 sessions left this year, and each program is limited to only 20 doctors. Just for our listeners, use the code 2021IMPACT, that's 2021IMPACT, all one word, for $700 off your tuition.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.